I grew up with bipolar disease with my father for my whole life. So I did receive counseling as a child and adolescent for bipolar disease and how to deal with it in a family situation. However, never received specific counseling as a caregiver. I did, though, go to most all of his psychiatrist appointments with him, which gave me a better understanding of how he was doing at the moment and how to care better for him and his needs specifically with his mental illness. The impact financially it had on me as a caregiver would probably be because it became close to a full-time job. I was unable to work outside the home. Fortunately, I was in a situation that didn't create too much burden on our family situation. However, it would have been helpful as my kids got to college age to be able to be working outside the home, which was not possible with being a caregiver. And as far as relationships and how it impacted my relationship with him, at times it did impact my relationship, my patience probably with him, being his caregiver instead of his daughter. It was hard at times because he began to look at me and me look at him, not in the normal father-daughter relationship, and just the stress of having to deal with all his specific needs became wearing on me to be compassionate as a daughter instead of just a caregiver. And then also relationships with other family members at times became strained because I became a little bit resentful for the role I was having to step up into as far as caregiving, and felt resentful towards other family members because I didn't feel were necessarily giving the amount of time they needed to help out. There were a variety of factors that led to making the decision to move my father into an assisted living facility. Primarily, with having a young family and children around, having him in the home with bipolar disorder was extremely difficult because of the nature of the illness and his being not stable and being not predictable as to what he might say and do. And with children, that's difficult for them to understand. So moving him in, that was one of probably the biggest factors. The other was his inability to handle the stress of caring for himself. Made it impossible for him to live on his own. And so moving into the assisted living was a benefit for both us as a family and for him as a receiver of the care. It also helped with socialization for him. It gave him an opportunity to be with those of his own age, which was very important to him. The difficulties of that, though, are because of the nature of the illness. He tended to have some problems with all the different personalities at an assisted living, and the fact that the elderly people lose their filter and don't always say exactly what they mean, and his interpretation of that at times caused some difficulties at the facility. So it was a fine line and a fine balance to have to keep. I had to be very close with the caregivers and people that were the administrators of the assisted living to make sure they kept me in the loop when he was starting to have difficulties, maybe saying something kind of a little off color or that didn't make sense, or if he was getting angry or having different issues like that. I needed to be involved so that I could get him in to see a psychiatrist right away. So while it was easier from a physical standpoint, caring for him, sometimes it became stressful just having to deal with making sure he didn't do something that would inhibit him from living there. And then how would it be different dealing with someone with bipolar versus just your traditional caregiver is kind of along those same lines. At times, they don't necessarily see exactly what's going on. They can tend to take things very personal, or the stress of just the illness itself, going from highs and being very hyper and very demanding of your time and your attention, to being depressed and not wanting to get up and get dressed and do normal daily activities was definitely a challenge. So being in the assisted living where others did that for you was definitely beneficial. As a physical therapist or any healthcare provider with a bipolar patient, I think it would be extremely important to be, first of all, meet with the family if possible, or those that they're around the most, to make sure you have a kind of a baseline understanding of what their normal moods would be, so that if you notice anything out of the ordinary, you can be extremely sensitive to that. It can be as minimal as just kidding around with them and they take it completely the wrong way. So I would suggest that with those types of patients, make sure to be really more of a listener than a conversationalist, and be very wary of straying off into different topics with those because of their sensitivity to outside comments. And also the moods as far as the physical, when they're depressed or when they're down, it might be a lot more difficult to motivate them. So you have to be compassionate and really work with them in understanding the moods that they're